Hey there, and welcome to The Deep Dive. You've shared some really interesting sources with us looking at India's medical tourism sector, so we're ready to unpack that.
Let's do it.
Our mission today is really to dive deep into what the material you sent tells us about, why India has become such a major global spot for healthcare.
That's right. And the sources, they paint a picture of just, well, tremendous growth.
Yeah.
Yeah, this isn't some small niche thing. We're talking about a major sector. The projection mentioned is hitting around $13 billion by 2026.
Wow.
That scale, tells you something significant is definitely happening there.
$13 billion. Okay, yeah, that certainly gets your attention. So beyond just that sheer size, what do the sources highlight? What are the kind of core drivers making this happen?
Well, what's really compelling, and it comes through in the sources, is it's not just one single thing.
Okay.
It's more like a confluence of factors all working together. But the most prominent one, the one mentioned again and again, is affordability.
Right.
Exactly. Treatments in India can cost, well, dramatically less. The sources are citing figures anywhere from, say, 60% up to even 90% cheaper.
90%.
90% cheaper than, the same procedures in places like the U.S. or the U.K.
That kind of cost difference, that's obviously a huge draw for people.
Huge.
But the immediate question, and I think anyone considering this would ask, is does that lower cost mean, lower quality care?
And that's really where the sources offer a key insight. They strongly emphasize that India has invested pretty heavily in high-quality infrastructure and expertise.
Okay.
We're talking hospitals with, advanced medical tech, often with international accreditation, Joint Commission International, JCI is mentioned.
JCI.
And there's this huge pool of skilled medical professionals, doctors, surgeons. Many of them, the sources note, have actually trained or worked internationally before coming back to India.
Oh, interesting.
Yeah, so it's framed less as a sacrifice of quality for price and more like a high-value proposition. You get both.
Okay, right. So it's affordable and you can access quality care. Got it. What about the government? What role does it play in sort of helping this along?
Government support seems crucial based on the material. The sources point to specific initiatives like the Heal in India program.
Heal in India.
Yeah, it's explicitly designed to promote the country as a destination for medical tourism.
How so?
Well, it involves efforts to improve facilities, streamline regulations, make the travel easier for patients. The e-medical visa systems is a really good example they mentioned.
Oh, the visa process.
Exactly. It simplifies entry for patients from, I think, a large number of countries. It removes a pretty significant logistical headache.
Yeah, that makes sense. Easing the travel part is incredibly important, especially if you're, traveling because you need medical treatment.
Definitely.
And it sounds like patients are coming from, well, everywhere.
Absolutely. The sources indicate that while, yes, Southeast Asia and the Middle East are major sources, you also see patients arriving from Europe, from Africa, even North America.
So it's truly global.
It speaks to both, I think, the recognition of the quality and those significant cost savings we talked about.
Right.
And this growing influx, it's being supported by expanding healthcare infrastructure, not just in the big metros like Delhi or Mumbai, but also consolidating in specific hubs. Chennai, for instance, was highlighted as India's healthcare capital.
Interesting. A healthcare capital. So you've got this powerful mix then, really striking affordability.
Yeah.
Internationally recognized quality standards, government backing, actively promoting it, and the infrastructure, the skilled people are there. And it covers complex stuff too, right? Cardiology, oncology, transplants. These aren't minor things.
Exactly right. The sheer breadth and depth of the services available seem key to attracting patients with all sorts of different medical needs.
Okay.
Now, look, while the trajectory is clearly upward, the sources do also touch on some challenges.
Like what?
Things like ensuring consistent quality across a sector that's expanding so rapidly. And maybe the need for, continued streamlining of processes. But they also see opportunities like using tech, maybe telemedicine for follow-ups or initial consults.
Right, leveraging technology. Okay.
Yeah.
It feels like it really gives a comprehensive picture of what's happening right now.
I think so.
So bringing it all together then,
Right.
What's the core takeaway from this deep dive into the sources for you listening?
I think the core message really is that India has successfully positioned itself as a very compelling destination. It's offering advanced, high-quality medical treatments
Right.
that are accessible at just a fraction of the cost you'd find elsewhere.
Okay.
And this is underpinned by strategic government support and a pretty robust healthcare ecosystem.
Okay. And here's maybe a final thought, kind of building on something else mentioned in the sources, something for you to ponder. We've mostly talked about these advanced medical treatments, right? Cardiology, surgery.
Yeah, the high-tech stuff.
But India also has this incredibly deep heritage in traditional wellness. Think Ayurveda, yoga.
True. Very true.
So consider how maybe the integration or even just the parallel promotion of those practices might shape India's appeal even more in the future.
Beyond just the conventional medical procedure.
Exactly. Potentially attracting a whole different, maybe broader group of health and wellness seekers. It sort of adds another interesting layer to the whole story, doesn't it?
It certainly does. Something to watch.